we have Nicoletta Dini. She's a med student at Dalhousie University, co-chair of the Dalhousie Med Green Team, and senior co-chair of HEART, the Canadian Federation of Medical Students National Planetary Health Committee, and she will be talking about the Health and Environment Adaptive Response Task Force, HEART.
So yes, my name is Nicoletta. I'm a third-year medical student at Dal and co-chair of CFMS HEART, and today I'll be presenting on Planetary Health Day of Action, investing in med student advocates to shape future leaders in sustainable healthcare. So we know what the problem is. Climate change is the greatest health threat of the 21st century. Not only will extreme heat, record-breaking wildfires, droughts, and floods contribute to more deaths, but healthcare can also reciprocally contribute to environmental degradation and worsening climate change, accounting up to 5% of Canada's greenhouse gas emissions. So today, I'm going to argue that the solution to this problem is to invest in shaping the future. Medical students are the future. Healthcare practitioners, policymakers, sustainability advocates. And as young citizens and soon-to-be physicians, they also have an inherent interest in understanding climate change's effect on healthcare and for caring for their future patients in a climate-changed world. In fact, studies show that a whopping 83% of medical students say they want to learn more. However, only 15% of medical schools worldwide include planetary health curriculum in their education. As a result, only a mere 6.3% of students reported feeling prepared to engage with planetary health. So we are losing a whole generation of planetary healthcare leaders, and that has big implications for the future. The key to breaking this reciprocal cycle is to intentionally shape a critical mass of medical students into knowledgeable planetary healthcare advocates to bring about the kind of planetary health leadership we need to see in our future health system. So this brings me to my model example for you in the Canadian Federation of Medical Students. CFMS is a student-led organization founded in 1977, representing over 9,000 medical students across 15 Canadian medical schools. Exploiting this reach, one of their key mandates is to spearhead political advocacy initiatives, uniting medical learners across the country. One such group of students felt that the health impacts of climate change was, unsurprisingly, underrepresented in medical education and advocacy. So as a result, in 2017, the Health and Environment Adaptive Response Task Force, or HEART, was founded to advance planetary health curriculum and advocacy initiatives. So we have numerous projects and partnerships on the go, including with CCGH that hosted us here today. But today I specifically want to tell you about Planetary Health Day of Action. So Planetary Health Day of Action is an inaugural advocacy initiative for CFMS HEART, and also organized in coordination with CAPE's National Day of Action on Planetary Health this coming Monday. So over the next 2 weeks, medical student delegates will lobby provincial politicians on key planetary health actions. The first of these asks is to establish sustainable healthcare secretariats across the provinces and territories in support of Goal 2 from Power and others. The second action is to support pre-existing planetary health initiatives that are specific to each province in collaboration with CAPE. So some examples, in my hometown, Nova Scotia, the Ecology Action Centre is lobbying to protect urban natural spaces like Sandina Lake from development. In Manitoba, Trees Please are calling for an expansion of urban tree canopies. In BC, CAPE and others are calling for a pause on all LNG and fracking projects. And in Ontario, CAPE is calling for integrating a heat adaptation requirement into rental housing standards. So far, Planetary Health Day of Action 2025 will have 7 provincial advocacy streams spanning BC to Newfoundland, and over 40 medical student delegates from more than 12 medical schools represented, also UBC to Memorial. So what's the plan? On Sunday, October 5th, we will have our first national training webinar where partner organizations and speakers will train medical students on how to effectively be planetary health advocates on their ask. Then, starting Monday, October 6th, same day as National Day of Action, 2 to 4 medical student groups will be scheduled to meet with provincial politicians and have some meetings. These will wrap up in 2 weeks' time by Friday, October 17th, with the exception of Newfoundland because they have a general election on the 14th. And then CFMS leadership will follow up to clarify what lessons were learned and gains were made. So in conclusion, how are we meant to measure the success of an event like Planetary Health Day of Action? We can measure whether that day and that week will have achieved any measurable policy change. And there's always the less measurable but still meaningful returns of amplifying those existing initiatives, leveraging social capital of medical students, and fostering those future political and inter-advocacy relationships. But my argument to you is that the real success of CFMS's Planetary Health Day of Action will be in the development of 40 future healthcare leaders into 40 planetary healthcare advocates. We have a long way to go, but if we are ever to dig our way out of the reciprocal cycle of climate and healthcare destruction, we need to be strategically investing our influence in the shapers of tomorrow. Thank you. If you have any questions, please email Hart, and please follow us on Instagram.